Well, greetings, friends, and welcome to Dialogues on Social Enterprise. My name is Andy Horowitz, and I'm your host on these programs. And we're really fortunate today to have with us Jack Shaw. Jack Shaw is I call Jack a pioneer in the area of a social enterprise. He's been doing it a lot longer than most of the groups we've talked to have at this point in time. But right now, Jack is there's something going on with one of the social enterprises that he has been working with, and he's here to talk a little bit about that, and then we're going to learn more about that enterprise and more about Jack. But what's going on right now, Jack?
Well, as we speak, we are in the process of implementing a major software hardware system for Healthy Smiles for Kids of Orange County. And that system will ultimately become a social enterprise resource for use by all of the clinics that provide dental services in Orange County. And so with the event of today is literally Healthy Smiles shut down for a day to begin this conversion. And by Monday morning, we will be on a new version of a system called Dentrix Enterprise, which is a multi-clinic system which integrates all of the aspects of the delivery of pediatric oral health to kids. The intake or registration, medical records, digital x-rays, insurance or customer billing of one kind or another into one system. And that system will ultimately be available for a network of clinics around the county.
Wow, exciting. And this is a project of, you said, Healthy Smiles. Let's step back. We'll come back to this particular installation and what it means from a standpoint of being able to service the organization. But what is Healthy Smiles exactly?
Well, Healthy Smiles for Kids of Orange County is a program that got underway about 6 years ago under the auspices of the Children and Families Commission of Orange County to provide specifically pediatric oral health to the 0 to 5 population, which is served by the Children and Families Commission. But our charge was to build a physical premises, a physical clinic, in cooperation with CHOC, the Children's Hospital of Orange County, and to be able to identify those children in the county in desperate need of oral health. The Pediatric Oral Health Initiative and the disease that accompanies it is actually the most contagious, most prevalent, and pervasive disease among our children today. Children born with, because of prenatal conditions, terrible oral health issues, and it just gets worse. And so we're in the business now of helping the 100,000 kids in Orange County who live below the federal poverty level, who have almost no access to pediatric oral health, and to be able to provide education, prevention, and treatment to those kids.
Quick question. The system going in now, which is really part of the revenue generating component, I guess you would say, of Healthy Smiles, how is that going to help you further the cause of the nonprofit, the mission?
That's a good question. We are mission driven, and our job is to network among all the communities in the county to build bridges and to be able to provide treatment across the county. And so having a single system with a single database and the ability to help these community clinics bill insurance, which in many cases they can't do because of its complexity, or to be able to track the outcomes that are achieved with treating these kids. All of that furthers our mission of delivering health care, pediatric health care, to these 100,000 kids.
Fabulous. Well, I think we will look forward to maybe learning in the future how this installation actually went and how the revenue generating capability of this new program, how successful it will be. You'll come back and talk to us a little bit about that.
It's an exciting time.
I think this is about all the time we have for Jack right now. I should say real briefly that this particular program is one of several that you're working on. Why don't you say a few words about the overall all the different components of your programs?
Well, the idea of social enterprise has probably been around forever. If you go back to Goodwill and other well-known, but for the most part, most social service delivery organizations don't think about revenue; they think about cost. And so what the model is that they've got to raise enough money to cover their cost, but they're cost-driven in the way they look at the world. The way we look at the world is revenue-driven, and we want to be able to generate revenue to support our mission, revenue from a variety of sources, including in payment for some of the services we provide for people that can afford to purchase such services. For example, in the Oakview community of Huntington Beach, we're actually going to kick off a farmer's market in the middle of the community to provide healthy, nutritious food, which is not available in the community, at price points that our residents can pay for, provide that to the community. And we will make money out of that in order to provide other programs in the community to support our services in that community.
I think with Jack Shaw, you see social enterprise at its best. Maybe when Jack comes back, we can talk a little more about his background. Very significant in the for-profit area. He was also a dean at the business school, at the Drucker School at Claremont for a couple of years, and also as a donor at the Orange County Community Foundation. A lot to talk about. We want to have you back, Jack, but thanks so much for...
thank you for having me.
Thank you for being here, and we're signing off now from Dialogues on Social Enterprise, and we'll see you next time.